So basically now we'll start another important tumor of salivary gland. So let's start it. Bismillahirrahmanirrahim. So basically it is we have adenoid cystic carcinoma. So why it is called adenoid and cystic carcinoma? It is called adenoid on the basis of this tumor appearance. This tumor appear microscopically as a gland type. So it is because of that appearance they are considered it is as adenoid. Cystic because it consists of fluid cyst, and a carcinoma it is a neoplasm. Okay, and it is so it is a malignant salivary gland tumor. It is composed of cuboidal cells. It is composed of cuboidal cells, but these cuboidal cells then are present in three forms: either solid form, form, or tubular form pattern, with a predilection for invading lymphatic and perineural spaces. Always remember that in this carcinoma, the perineural spaces or invasion is very in early stages as compared to other neoplasm carcinomas in which perineural invasion occurs in the later stages. So it spreads very fast, we can say. Okay. Now what we have studied, you have studied that the cuboidal cells are in three forms: solid, form, tubular. Mostly it involves the lymphatics, and it early invade the perineural spaces. Okay. Again, adenoid cystic carcinoma can be calendroma. It can also called by cylindroma. You can also call cylindroma. And the second most common malignancy it is. Okay, and it is again slow growing, aggressive, and malignant. Okay, now how it basically it arise from the pluripotential reservoir cells. These cells are present in the acini, in the intercollected ducts, at the junction acinal intercollected junctions and intercollected ducts. Okay, it occurs from the pluripotential reservoir cells. They are present at the junction of the intercollected ducts, you can say. No particularly consist genetic factors. It is not basically consistent of genetic factors have been identified, although P53 gene inactivation have been seen in advanced stages. P53 gene was a tumor suppressor gene, and this gene detects the damage or abnormal DNA due to which it does not complete its cell cycle. Okay, so they are saying that in advanced stages of this carcinoma, this gene becomes inactive. Okay, clinical features mainly major salivary gland, then it involves the minor salivary gland. Okay, okay. Again, they are shown on the palatal area. Okay, okay. So they are saying that the patient can have facial paralysis. Again, yes, it is a slow growing mass. It is smooth or ulcerative. It can be on palatal area. Okay, it can have a dull low grade and dull pain and numbness, and also perineural invasion. So what happens when there is a perineural invasion? So the patient feel pain, and the pain is low grade, and due to which in advanced stages it become numbness. So what happens when it invades perineurally? So it has a pain. There's a dull itching pain. That dull itching pain in advanced stages becomes numbness. Okay, it involves the neurons. Okay, and this they are saying that there's a mild pain, paresthesia, and a late onset of the metastasis. Okay, okay. It has three forms: form, tubular form, and solid, and the major is for form, you can say. You can see it. Okay, now again, it is composed of ductal and myoepithelium cells, like it was pleomorphic adenoma, right? These cells are arranged in three forms: ciliary tubular form, and solid form. In ciliary form, it is a classic characterized by islands of basaloid epithelial cells have multiple cyst-like spaces and very important a Swiss cheese appearance. So what happens that they are saying in ciliary form, it is a classic ciliary form. A classic means it's old and it is characterized by there are islands of basaloid cells, and these basaloid cells have multiple cyst-like spaces. You can see here these are the islands of the basaloid cells with cyst-like spaces. Means you can see this is the island of the basaloid cells, and in them inside there is a cyst and surrounded by basaloid cells. Okay, then these spaces contain basophilic mucoid material. It has of course mucous material, hyalinized eosinophilic product or combination. Okay, so what we have studied in ciliary form number 1, it is an old classic pattern. It has an islands of basaloid cells, and these basaloid cells are basically having cystic like spaces and giving a Swiss cheese appearance of pattern. The cystic spaces contain either hyalinized material or mucoid material. You can see here basically Swiss cheese appearance. It has basaloid cells. Okay. Okay, some people say that it might contain of the glycosaminoglycans, or either okay, so it can be either hyalinase or basophilic. Okay, you can see here the ciliary from pattern, low power. You can see here that what happens that we have said that the ciliary form is the most classic, and it is characterized by the islands of basaloid cells. These basaloid cells then have cystic species, and these cystic species give the appearance of the Swiss cheese appearance. You can see here. Okay. Mm. Either they contain hyalinized material, and it is also surrounded by hyalinized material. Always remember, like now you can see here more clearly. These are the cystic spaces. This they have hyalinized material also surrounded by hyalins, and this is darkly stained basaloid cells. Okay, again high power. Perinuclear region is very early stage it occurs. And now it is a tubular pattern. In tubular pattern, when you can see here that it is arranged in the tubular form. Basaloid cells are surrounding the cystic spaces. Okay, and here is a hyalinized stroma. You can see this is the tubular pattern, which is composed of inner ductal and myoepithelium cells, and these ductal cells are either cuboidal with eosinophilic cytoplasm, and myoepithelium cells are angulated or basaloid. Okay, now then solid form, you can see here the solid form that is the cells becomes large, like it has pleomorphism. You can see mitotic factors, coagulative necrosis. So here the cystic spaces, very small cystic spaces have here. These are either sheet arrangement or islands arrangement of cells. No cystic spaces or less cystic spaces. You can see tumor cells forming a solid sheet of cells. You can see here. Grading. Now in grade 1, what happened, there is only cilibriform and tubular form, but no solid islands and no pleomorphism. In stage 2, what happens, there is three of the cells are present, either cilibriform, you can say, either tubular form, you can say, either it is solid form it is present. In there is a mild pleomorphism in this stage. In stage 3, there is only solid form. There is only solid form, solid islands, and pleomorphism, mitotic figures, and necrosis is present basically in grade 3. Treatment differentials can be mucoepidermoid carcinoma, polymorphous low-grade adenocarcinoma, and squamous cell carcinoma. मतलब you can have mucoepidermoid and squamous cell carcinoma, and also the polymorphous low-grade adenocarcinoma. You can have it. Treatment surgery can be done with the radiography recurrence. It is prone to recurrence. Metastasis is lungs in more common than to lymph nodes. it metastasizes to the lungs very fast because this is large, no? It has large cells, due to which it cannot, which I have tell you that it has a very basically um, due to which it can move to lungs but not to regional lymph nodes. Okay, the cure rate is very it is low. The cure rate is low. Factors that affect the prognosis is either the site, basically histological pattern, and neurospread. You can see it just assist to that then. Okay.